We'll look at the hormonal regulation of blood pressure. So we're going to look at 4 hormonal systems or hormones. And the first one, and the one that is the most complex in activation, is the renin-angiotensin-aldosterone system. And this is very important in how blood pressure is controlled. So what happens is the first hormone that sets this system into action is renin. And renin is released by the kidneys when blood volume is low. And it goes through a system of being activated until we get to something called angiotensin II, which is a potent vasoconstrictor, which we know that vasoconstriction can raise resistance and raise blood pressure. But the other big thing angiotensin does is stimulates a very important hormone to blood pressure called aldosterone. And it is important in water conservation as well as sodium. And what it does is causes the kidney to reabsorb sodium and water so that we retain water for increasing blood volume, which also increases blood pressure. So the easiest way to do this is to view this flow chart. So notice that a decrease in blood volume due to sodium deficiency, bleeding or hemorrhage, dehydration will increase blood pressure, which causes the juxtaglomerular cells of the kidney to release the hormone renin. Now what renin does, renin is actually an enzyme itself. And the liver releases something known as angiotensinogen, you see there in image 6. And what renin does, it's an enzyme that cleaves angiotensinogen and we create angiotensin I. Angiotensin I itself, when this is increased, the lungs will increase another enzyme called angiotensin converting enzyme. We have it abbreviated ACE there. So you've got yet another enzyme. We had renin as the first one, angiotensin converting enzyme is the second one, but angiotensin converting enzyme converts angiotensin I to angiotensin II. And that is our first important hormonal point that is really affecting our blood pressure, and we said that angiotensin II does this in 2 ways. A vasoconstrictor, which increases resistance and therefore blood pressure, but one of the most important things it does is it stimulates your adrenal cortex to release the hormone aldosterone. Now notice here in image 16 that increased potassium can also stimulate the adrenal cortex to release more aldosterone. The more aldosterone that is released, the more sodium and water reabsorption happens in the kidneys. When we retain more sodium and water, we increase blood volume until our blood pressure goes back to normal. So aldosterone is one of the most important water-conserving hormones that helps maintain our blood pressure. So this is the RAS system, renin-angiotensin-aldosterone system. Epinephrine and norepinephrine should be something that is familiar. These are released by the adrenal medulla, and what they do directly is cause vasoconstriction in your blood vessels, which increases resistance and increases blood pressure. It directs blood flow to skeletal muscle during exercise and also increases our blood volume by increasing the heart rate. So if we increase our cardiac output, if we increase our heart rate and we increase our cardiac output and stroke volume. Antidiuretic hormone, ADH, is released by the posterior pituitary gland in response to low blood volume. A little bit similar to how aldosterone works, except this is focusing primarily on water, where we looked at aldosterone, also water following the sodium. But antidiuretic hormone is responsible for the thirst response, but it causes vasoconstriction and promotes the retention of water from the kidney. So kind of like aldosterone, we are increasing water in the blood, so we are also raising blood pressure. So the result is an increase in blood volume, a decrease in urine, and also an increase in our thirst response. Finally, atrial natriuretic peptide works differently than the other 3 in that when we have this released, we are going to lower blood pressure. It's released by atrial cells of the heart when blood pressure is too high, whenever they are stretched because of maybe a higher blood volume. So what it does is causes the opposite, vasodilation, and it promotes sodium and water loss in the urine. So it is going to cause more water to be lost. The result is reduced blood volume, reduced resistance, increased urine volume, and a decreased blood pressure. So you can think of this as the opposite of how ADH and aldosterone work.